I remember it being very stressful when I first started. While I was in school, dealing with school and working. I wasn't working a crazy amount of hours, but I also, something that really stands out is I was kind of having a hard time relating to my peers that were not in nursing, because I was getting a lot of exposure to people who were in life and death situations or who were in really bad shape, and other 20-year-olds around me were not.
From the cubicle to the lab, the studio to the war room, climbing the corporate ladder, or joining a scrappy startup, experience a day in the life of the jobs you want.
You're now listening to the Experience a Diddle podcast. You'll hear from professionals, entrepreneurs, and recent grads, all inspiring you to gain experience beyond the classroom and launch a career of your own.
We're your hosts, Chris DeBow
and Matt Poe.
Welcome to the Experience episode in the Nursing MS series with NYU Senior Staff Nurse Jennifer Abate. In this episode, we're going to review Jennifer's resume from nursing school to where she is today. And we'll even touch upon her plans for the future. Nursing students, listen up. Jennifer answers a lot of questions you probably have and gives some tips on how to hack it in the field of nursing.
Jennifer attended Seton Hall University in New Jersey and had a completely different career directive starting out.
Yeah, so funny story, nursing wasn't my first major.
Oh yeah? What was it?
International relations.
It's getting juicy. All right.
Yeah, so I love this podcast because I myself had been in the same situation.
Gotcha.
Spill
the tea. Let us know.
So I thought international relations, this is great. You can help people on a large scale, learn languages, learn about policy, and, I can help change health policy internationally. I thought, this is amazing. I got into it and I thought, I don't want to be like every other woman in my family who's a nurse. That's not me. I have all these thoughts. And while I was in school, I realized, wow, I really am meant to be a nurse.
Yeah.
What was that realization like?
So I was in IR and most of the students were very political. Mm-hmm. And I realized that I didn't know as much about politics as I thought I did.
They probably don't either, honestly.
Yeah, I was going to say.
Probably not. Yeah. And I felt really stupid around these kids who were like very global. A lot of them they had dual citizenship in other countries. Their parents would raise them going to these different countries. And I was like, wow, this isn't what I know. I grew up talking medicine in my house. Pretty much that was always the dinner table conversation. And I always, of course, looked up to my mother. So one day I was talking to a guidance counselor at Seton Hall, and we were talking, and she's like, sometimes we go for things and we don't realize that we're trying to be just like somebody that we think is our role model. And I was like, wow, you're right. And I tried a nursing class and I loved it. And I was like, this is what I need to do.
That's amazing. So What year was that in your
undergrad? Was halfway through sophomore year.
Sophomore year. So you probably had a lot of catch up with the nursing
back.
program. Did you still graduate within 4 years?
No.
Or you didn't? Okay, you had to take an extra year.
Yep.
Gotcha.
Extra summer, extra year. It was stressful, but it was worth it.
When we spoke on the phone, I'd asked you why you became a nurse, even though the stakes are high and that there's tons that go unnoticed or thankless. And you told me what, I expected you to say was that you wanted to help people, but could you also talk about what else made you?
Yes. So, of course, I like to help people. I think all nurses would say that. But I found from a younger age that when I was speaking to friends, they would confide in me about really personal things that weren't always a comfortable topic. I was always that go-to person. I don't know how detailed you guys want me to get.
No, go for it.
Go as detailed as you want to get.
So I think like any of my friends that would listen to this now would just die laughing when they hear me say like, Jenny, I have diarrhea. Do you have any medicine on you? From like a young age in junior high, throughout high school, throughout college. I mean, I think I was always the go-to friend. Do I have an STD? Something's going on. What is it?
Totally.
Any crazy thing you can think of. I feel like I was that person. And it was very comfortable to me. And I got a lot out of knowing that I made them feel better. Mm-hmm. And I was okay with talking about it. It was very comfortable to me.
I'm sure a lot of people are hesitant to make the major or program switch with the fear of not graduating on time, as if it's like the end of the world if you don't graduate in 4 years. Jennifer is proof that there's no shame in doing that, especially if it's a career you want to pursue.
I want to go back to classes. What is nursing school structured like at Seton Hall? Is it lectures like you were mentioning it? Are you actually in the field for some credits? How is that working?
So it starts off pretty much, this is how I started. And if you were a freshman going into school, you would start with the first didactic classes. You would take your core classes for a bachelor's degree.
What does that mean?
In classroom work.
Oh, okay.
You take, like the basic classes for when you start school, statistics, sociology, psychology, you kind of take all those classes, but they mix in a lot of the nursing classes early. So you would start taking basic anatomy, physiology. They would start putting in classes like microbiology and chemistry classes.
So you're doing the same classes as like pre-med, like doctors are, right?
Yeah.
That's so interesting.
Some of the classes are very similar, and some of them I think are just a little structurally different because they're more focused on how we would use the material.
When you did make the jump into nursing, were you prepared for all this? Did you know what you were going to get into, or was it you were going in dark?
I don't think I realized it was going to be so hard.
Gotcha. Yeah, we were reading about nursing school, and a lot of sentiment is it's very hard.
Yeah, I don't remember the statistics, but it's like the most tests you're going to take in an undergraduate program is in a nursing program.
Yes, I read that too.
Yeah.
That is like...
It's pretty stressful.
So what was your hardest class?
Ooh, probably between chemistry, micro, and pathology.
Gotcha.
Pathophysiology, I'm sorry.
Pathophysiology.
Yeah. Pathophysiology.
It's more complex.
That was a rough class as an undergrad.
And they, like the way it's structured is you're taking all of those classes a lot at the same time. So
Yes.
I bet like,
Yeah.
were you pulling a lot of all-nighters? Like what was...
Yeah.
Sheesh.
Yeah.
That's
and then,
rough.
you mix pharmacology and you're starting to learn about drugs. So that's a heavy semester when you have a lot of those classes.
So is this on a credit basis, or did you have to put some hours in as well? That's kind of what I was reading about.
Yes.
How does that work?
So as you start getting into your third and fourth years, you start clinical. And that's when you mix in classroom work with also professors who take you to clinical sites, different hospitals. Some clinicals are about home care, so you actually go with a professor to people's homes. And so it's all different. Sometimes you go to a psych ward, and this all prepares you for when you're actually a nurse in the field.
Gotcha. And can we, the grades, like, do you have to have a certain mark to be able to move on? What's that like?
I think at Seton Hall, don't quote me, but I remember you had to keep at least a B average to stay in the program.
We checked. To graduate, you need at least a B average at Seton Hall, and that's pretty standard across the board for other nursing programs. During her last 2 years of nursing, Jennifer worked at Newark Beth Israel Medical Center as a unit clerk in a patient transport.
So I guess we'll talk about your first contact with live patients, real humans. What you were a patient transport. What does that mean? What were you doing? What was that transition like?
So while I was in nursing school, I had one of my roommates was working at a local hospital in Newark, New Jersey. And they said, we need staff. We need nursing students. So do you have any friends? So she was like, hey, they're hiring. Do you want to come to the hospital and get some experience? So I said, yeah, of course. So I worked for a short time as a unit clerk, which is a person who kind of does the administrative work on the units in the hospitals. So they answer the phones, they help you with the charts. They're a really, really helpful person when you're a nurse.
Totally.
So you learn a lot because you have to transcribe doctor's orders and you're looking through things all day long. You're kind of helping to alert the nurses there's new orders. So I thought that was great. But then this transport job opened where I could actually like really touch patients. And that's what I really wanted to do was get in there. So I started working as a transporter.
And what year was this in college?
This was through my third year in college.
Okay, great.
Yeah, third year. And so you can also call that patient transport or orderly. And I would transport patients all throughout the hospital to different places. So let's say they were in the emergency room and they needed an x-ray. I would take them over to x-ray.
Nice.
Sometimes that was in a wheelchair and sometimes it was in a stretcher.
Right.
And I would do it by myself. So I was in really good shape at the time.
That's great. Is that normal for nursing students to get like outside experience like that early on, or just because, and talking about like balancing your own coursework and stuff like that while you were doing that, like that must have been super intense.
I think it's normal. I don't think everybody does it, but I think that it's a great idea for somebody if they can do it. There were a couple of other students who were also working at different hospitals while I was in school too. But the majority of the girls I was with were not working in a hospital with patients. So I feel like I had a lot more exposure early on.
Right, which is our whole mission here.
Yeah.
You know,
Yeah, I think it was very helpful.
That's awesome. So today is World Mental Health Day, which is interesting. I wanted to kind of shift gears a little bit towards that theme. You told me doing nursing school, you not only had to learn how to physically be a nurse, but also learn to get over the fears of being a nurse. Could you talk about like your emotional and mental state, like at that point when you were like working with patients for the first time and you know, being right in the action? Can you talk a little bit about that?
I remember it being very stressful when I first started. You know, while I was in school, dealing with school and working. I wasn't working a crazy amount of hours, but I also, something that really stands out is I was kind of having a hard time relating to my peers that were not in nursing, because I was getting a lot of exposure to people who were in life and death situations or who were in really bad shape. And, you know, other 20-year-olds around me were not. And they, you know, when I had to be at work, I had to be professional and I had to act accordingly to my job position. And so I remember I kind of had a lot of the same feeling as my fellow nursing students, because we kind of all experienced that. And I think that's why we were all pretty close in school. And yeah, like sometimes we're very emotional because you were faced with things maybe you were never exposed to growing
right, and
up.
at such a young age too.
Yeah, you know, unfortunately, some people, they grow up with a lot of tragedy in their lives, so that's normal for them. I wasn't one of those people. So it was a big culture shock for me, for sure.
Nursing school can be stressful for all sorts of reasons, but Jennifer was not alone in the struggle during nursing school.
I would say the girls that I got paired up with to do clinicals with, we all became really good friends.
Nice.
Okay.
We spent so much time together. We were going through the same experiences. So we started working out together because we were on the same
fun.
schedule.
Right.
Yeah. So
Gotcha.
it's
Cool.
kind of did everything together for a few years.
That's awesome.
I think it's pretty important to, like, in college at least, this is something I didn't do, but like surround yourself with people in the same major, regardless of what major it is, because you can bounce ideas off, go for support and things, stuff like that. So good
That
on you
helped.
for doing that. Yeah, I'm
helps a
sure it
lot.
really was a good crutch. The next job was to be an ER or a technician.
Mhm.
How'd you go about getting that job?
So I had been working in the hospital as this patient transport, and I was with the nurses all the time because I just wanted to be one of them so bad. One of the nurse managers, who was my favorite, Vella, she was like, all right, honey, as soon as you get some time in clinical, you can be a tech, which to be a tech was like the best thing because you would draw blood and do EKGs and help people and clean them, and pretty much a nurse's assistant, everything you could do.
So that was at the same hospital that you were.
Yeah.
Did the job just kind of fall in your lap, or did you have to apply and interview and things like that?
They
or?
did make me interview.
Okay.
But they kind of winked the whole time, you know, like
Okay.
just she was like, if you get A's in all of your classes. And I was like, okay. Or she's like, or at least a B plus, something like that. And so,
Nice.
yeah.
Awesome.
Did you graduate at this point when you got the job, or was that like
When I-
fourth year, fifth year?
So when I was in ER tech, I was still in school, still in nursing school.
Okay,
Yeah.
gotcha. So working at the hospital, you were pretty exposed to like the pretty notoriously difficult bureaucracy within a hospital, you know, between like the relationships between doctors, physicians' assistants, nurses. Can you talk a little bit about that and how you kind of navigated the seemingly like pretty political landscape terrain, I guess?
Yeah. So I would say the best thing to do is to do your work and stay out of politics as much as you can when you're at work. I would say that there are some situations where nurses and doctors, maybe they don't agree on a situation. But the best thing to do is to keep it professional and just give the facts. Don't get emotional.
Right.
I think that's always the best thing to do.
Jennifer graduated nursing school, and now it was time to take the NCLEX, which is notoriously hard. She had to pass the test before she can work anywhere as a nurse. What format is that test in?
So it's a multiple choice
Oh,
test.
so you're not actually you're not performing any
No.
blood work, you don't. Okay.
No,
so
no,
it's
no.
multiple choice.
Yep.
Okay. Can you talk about the preparation behind it? How long did you have to start preparing and studying to get to pass?
Well, they pretty much start preparing you. I know at Seton Hall, I felt like I thought they did an excellent job at preparing us because I felt like compared to other people I knew in my age range that didn't go to Seton Hall, some of them, I think they had a harder time on the NCLEX versus a lot of my friends that I was in school with. We all seemed to, it wasn't as, we felt we were prepared for the test. I don't want to say it was easy because that is not true. That would be crazy for me to say.
So what year did they start preparing you?
I would say your last year of school. In part of your classes, you have assignments that are mini NCLEX tests.
Oh, cool.
And that goes part of your grade so that you really take it seriously.
Nice.
I don't know if they still do that, but it was really stressful. But it was so great because by the time I was actually going to take the NCLEX, I was like, oh, I've kind of done a mini version of this a couple of times.
Right. It didn't sting as bad or whatever.
Exactly. It wasn't
stressful,
so nervous.
but yeah. That's interesting. So did you take this test after you graduate or you take it to graduate?
You take it after you graduate.
After you graduate. So when you graduate undergrad, you just have your bachelor's degree in nursing. And then you have to have a certain amount of, you have to have a certain grade average and all of that to take this exam? Or what was the requirements, I guess, to take it?
Just graduation from an accredited program.
Gotcha. Okay, cool. Sweet.
Cool. All right, so now you're all licensed up, obviously, and graduated, and you immediately get a full-time position at the ER at the same hospital, right? How did you turn this, I guess, internship experience into a full-time job?
I made it very clear through everybody that I worked with that I wanted to be an ER nurse.
Gotcha.
And I wanted to work there, and I really took it very seriously, and I was very responsible about a lot of things because I wanted them to look at me like I was a serious candidate. And I think that that's what differentiated me from another person who had been working as an ER tech at the time who did not end up getting hired as a nurse when they passed the NCLEX.
Gotcha.
Yeah.
Gotcha.
So they made you interview for that as well then, I guess?
They did. They took that one more seriously. Yes. I had a real interview. It was very official.
Like?
I had to speak to the HR department and send in an application, and they contacted me. I interviewed with HR, and then the nurse manager set up an appointment time and for me to come in, and I had to interview with all the nurse managers and the director, and they took it really seriously.
So what kind of questions is the HR manager asking you versus the questions that the nurse managers are asking you?
I would say they're kind of similar.
Yeah.
In a way. Because I think HR
screens you a little bit.
Yes.
Yeah.
Yeah. And then the nurse managers, I think their questions are a little bit like that, but more detailed. And I've noticed with any interview I've had with nurses, they want to know how you handle pressure and what you're going to do in a situation when you might not know what to do.
Gotcha.
They want to make sure you're not dangerous.
Gotcha. Okay, so they'll give you hypotheticals and you would have to answer.
Yes.
Those are type of questions. Wow. Okay.
Cool.
Nice.
So what was this transition like? I mean, being at the same hospital, but now in a different role. How did you handle that? Was there any difficulties or challenges?
I think sometimes certain people I worked with, like nurses or doctors, would kind of forget that I was a nurse. But I have to say, all in all, everyone was really good to me.
Nice.
Everyone took me under their wing. They knew me since I had been in college, and I felt very comfortable. So
Nice.
I felt like I had a lot of support.
Cool.
Cool.
Yeah.
And what was your shift there?
I would work 7 a.m. to 7 p.m.
7 a.m. to 7 p.m. That's not horrible. Like,
Yeah.
12 hours.
I mean, it's 12 hours, but like at least it's
Yeah.
not, the other way around. I don't know.
How did your responsibilities change, though, from being an ER tech to now an ER nurse?
Well, I went from having to do tasks for different nurses with no responsibility. My responsibility was just, do that task, to now, if something happens to the patient, I'm the one who has to be able to identify it, because the doctors can't keep track of every patient in the ER. A lot of people will say, well, that's why the doctors are there. But the doctors aren't there to keep track and watch the status.
Monitor,
They can't. There's just not enough of them. So that's your job, is to make sure that the patient is alive and that something's
Very
not
important.
happening that you missed.
Cool.
You want to make sure you're really keeping an eye on them.
So did you have your own ER techs that you could tell what to do and stuff?
Yeah, they would have like one ER tech for maybe every 5 nurses.
Cool.
Gotcha.
So I think also you had to be mindful of not asking too much of them, because they're there to be helpful. So not to take advantage.
I remember you saying you had nightmares. Like,
Oh, yeah.
what was that?
So when I became a nurse and I was working in the ER, I had nightmares like every night for a year straight. Maybe not every night, but
Yeah.
I had the nightmares, as all the other nurses called it, and they would kind of laugh and say, like, don't worry, it's going to get better. We've all been there before. You run the whole shift in your mind all night long.
Yeah. And were the nightmares like related to the shift
Oh,
before?
yeah. It was what I was doing at
Was?
work.
Wow.
Yeah.
Oh my gosh.
That's scary.
That's
Yeah, sometimes it was. And I would wake up and I'd be like, oh, wait, okay, we're good.
Speaking of nightmares, this one's not as intense, but still something to confront. There's an intra-hospital rivalry going on between the ICU/CCU nurses and ER nurses. Jennifer explains why they've got a little bit of beef with one another.
That is a thing.
It is.
Yes.
Can you talk about that?
So when you're an ER nurse, the last thing you want to do is bring a patient upstairs to the ICU. I just remember not wanting to go upstairs to the ICU. Those nurses were so scary.
Were they bullies?
They were a little scary. They want you to have your bed perfect. The patient better be clean, and there better not be any blood work or medications pending.
Oh my gosh.
So that's pretty stressful. And, when you're an ER nurse, you have a million patients at once.
Right.
And you're just trying to keep everybody stable.
Right.
You're not there to prevent things from happening. So it's a
Exactly.
very different mindset, and that can be very scary when you're new.
Can you talk a little bit about how you prioritize your tasks, like a little bit in that high stress environment when there's so many critical things to do at once?
So a big part of this comes when you're in training and you're in orientation when you're a new nurse. That's what a major focus is on priorities. You want to always focus on the most critical situation and what needs to be addressed right now.
Right.
And then you work your way down. Don't focus on charting something that you can chart in an hour if patient's blood pressure is dropping.
Gotcha.
So that's kind of how I always, good rule of thumb.
After a few years in the ER, Jennifer was ready for a new challenge, and she found it upstairs in the same hospital.
And I thought, I can take care of critical patients down here, and I take care of a lot of patients at once. So I want to try the ICU out. I can totally do this. And then I got upstairs and I was like, oh, wow, there's a reason these nurses only have 2 or 3 patients at most.
Oh, yeah? Why is that?
There's just so many things going on with these people. And your job is to make sure that it's getting done. The patient, so your job switches from not just keeping them alive, but actually preventing events from occurring.
Interesting. Gotcha.
It's a whole mindset.
Yeah.
Yes, very different thought process.
So can you walk through the process like a little bit, your thought process there?
Yeah. So instead of sitting around and you look at the labs and you notice that the potassium's low, moving on to the next task, in the ICU, your job would be to go and make sure the doctors are aware and get the potassium going so that the patient doesn't have an arrhythmia. Downstairs in the ER, you don't really have a lot of time to do things like that because you have so many patients. So you notice when the patient's in an arrhythmia.
Wow. Yeah.
Oh, okay.
Sometimes.
That paints a picture of the difference perfectly.
You're like, they're having some arrhythmias. Let's check electrolytes.
Oh,
Versus in the ICU, you already checked them. They're already corrected.
So what do they look like when?
So it could be different, but let's say you have too much potassium, you can start having peak T waves. So when you're looking at an EKG strip, you notice kind of like that end of the EKG part of it kind of goes up higher than it's supposed to.
Okay.
And if your potassium is too high, you can have a cardiac arrest because your heart stops.
Wow.
That's an extreme scenario, but I'm just saying,
Yeah.
So electrolytes are very important.
The transition between ER, like was just because the ER was really intense, you'd said that you had nightmares like working there. Was it this like kind of the same rough on your mental?
The nightmares came back.
Yeah, they did.
They did.
Oh,
they did.
No.
Yeah, I had a lot of anxiety when I first started in the CCU.
Yeah.
I remember thinking, wow, I have like way too much responsibility for one person. You know, like I can't, how am I supposed to do this? They're asking so much, but you learn.
And not to say like obviously all patients should be prioritized, but when you have less patients and you have to do more with that one patient, you kind of like, I would imagine, have like a little bit more of like an emotional like attachment to them. So I can imagine that can be difficult, especially if.
Yeah. And some of them, they stay on the unit for months.
Right.
And you really get to know them, their families.
Yeah.
You know their medical chart really well.
Right.
You know what they like to eat. You know a lot of little things about them. So yeah, you definitely get attached to some of them.
Right.
Most of them, yeah.
And then, so you really have to like compartmentalize like your emotions. Can you talk a little bit about that?
So I'm not good at doing this. There are some people that are really good and they leave what happened at work. Mm-hmm. I'm not one of those people. So I often will be known to bring things home with me or think about it in my car ride home. So I think that that's a skill I'm still learning.
Right.
But I know a lot of people who I would say feel the same way.
Yeah. What are some things that you try to get your mind off of it?
Music, exercising, talking about it with, a friend or family member if I can. And that typically helps to kind of like release it.
Jennifer worked in the ICU full time until she found and got another job at NYU, where she is now. More on that job in the Diddle episode that's out now, but she still works per diem or per day at this hospital in the ICU at least once a month, or really whenever she needs it. Let's learn what she does at those days in the ICU as a mini Diddle in this experience episode.
So that would entail waking up probably by 5:30 in the morning, getting going, getting coffee.
Nice.
And
coffee's important.
Yes.
What's your order?
I usually like a coconut milk latte.
Okay.
Yeah.
Nice.
All right.
A little bit of cinnamon.
Okay. I love it.
And so you want to get to the hospital and be ready to sit down and get report from the night nurse by 7 a.m. because that nurse wants to go home.
Totally.
And you get it. They're exhausted.
Right.
So you try to get there. Before that, you just swing by where the charge nurse is sitting, look at your assignment. They usually have it on a little chart, what your assignment is for the day. So you get your assignment, you find the night nurses who had your patients, and you start with shift report, and you get a very detailed report of the patients that you have. Nice. They go through a head-to-toe assessment, the medications they're on, past medical history, their status throughout the night. I mean, it's very detailed. It takes us a long time.
Yeah.
Then you would go into the room, do a bedside report. You kind of check everything with the night nurse. And if the patient is awake, you also will introduce yourself at that point and kind of say goodbye and just ask them if they need anything while we're doing report.
Nice.
And so that kind of goes on. That can go till 8 o'clock in the morning, 8:30. And then you start. So typically during the day, you want to make sure you have vitals on patients at least every hour.
Okay.
And you're doing a full head-to-toe assessment on them at least every 4.
And vitals are checking blood pressure, right? What else? I don't know what else.
Blood pressure, heart rate, respirations, oxygen saturation,
cool.
Pain level.
Okay.
Just making sure they're okay.
Nice.
Heart rhythm is usually a part of that. So you generally want to do that, and you want to do a really good assessment of them at least every 4 hours. But that's pending that they're stable and that there's nothing else crucial going on that you really have to watch for throughout the day.
Gotcha.
And you kind of keep in that pattern of every hour, every 4 hours. So
And how many patients are you keeping track of today?
So usually it's 2, sometimes it's 3.
Sometimes it's
Occasionally you have a 1, and that's if the person is very critically ill.
Gotcha.
Yeah.
And how do the managers, they just like assign you patients, or?
I would say that they do it based on experience level.
Okay.
They are not going to give a brand new nurse the sickest patient on the unit.
Gotcha. Cool.
Just for safety reasons.
That makes sense.
Yeah.
Sweet.
So your whole day is just running vitals there, and every 1 hour, 4 hours going back and forth.
Yeah.
For 12, 13 hours.
Yep.
a day.
You're turning them every 2. You're feeding them if they need assistance, giving them medications. But while this is all happening, you're ensuring that every little thing about them is where it's supposed to be.
Right.
Sure. Wow.
So it
Do you
gets
ever
hectic.
yeah, I bet. Do you ever like sit and chat with them for like a while?
Oh yeah.
Okay.
If they're awake, I try to do my charting in the room with them
Nice.
because it's kind of like they don't have to be alone, and you get to know them, and you're also doing your work, so you're not just not doing anything. You're making use of the time.
Right. And when you're charting, you're taking down their vitals. You're just
Yeah.
recording
I don't think
everything
they
that you're
even-
mentioned.
I don't think they even
Everything that
realize
you're
that
seeing.
what we're doing while we're
Sweet.
talking. They just think we're having a
Nice.
conversation.
And when you say charting, that's like the thing that they wheel in with the
Yes.
computer. Okay,
Yeah,
cool.
Yeah.
Okay, nice.
I had a question about the frequency that you work there. You said it's about once a month.
Mhm.
Why is that like the optimal amount of time? Do you ever work more? Is it?
Yeah, sometimes I work more.
Okay.
Sometimes I work less. If some months I want to get some extra money, I need to travel, I can work more,
Gotcha.
which I really like. That's really flexible.
Totally.
Um,
And per diem, is it like an hourly rate, I would assume?
yes. So you are paid hourly,
Okay.
typically. And when you work per diem, you're not getting paid benefits. So typically the rate is a little bit higher than it would be if you were a part-time or full-time worker.
Gotcha.
Cool.
Cool.
So,
So I feel like it would be almost arguable that nurses would want to be per diem at like just a bunch of different hospitals, right?
Well,
if they would end
then
up
you don't
getting
get
more,
the
but then you don't get the
benefits. Yeah.
benefits.
Some
Yeah.
people do that.
Some people do that.
Yeah, if they have a spouse or significant other that can
That
carry them
have- yeah.
benefits. Yeah.
so now you are a senior staff nurse. Can you talk about why you made that jump and then how you got yourself involved in a university hospital?
So someone in my family has MS, so that kind of piqued my interest.
Gotcha.
And a nurse that was working there said, hey, they have an opening, and I think that you'd be a really great fit for it. And it's kind of different. It's something you've never done before. Are you interested? I said, yeah, definitely. I want to try something new. And so I interviewed, and I thought it was really interesting. And then I started. And yeah, it's been a very different situation because it's a more academic environment than what I'm used to.
Jennifer loves her job at NYU for many reasons, and one of them is the opportunity to study there for her master's degree. She enrolled in the nurse practitioner program, specializing as a family nurse practitioner, and plans to graduate in 2021.
Can you tell us about why you decided to go back into school?
Yeah. So I love my job. I have amazing nurses and coworkers at it. The doctor that I work under is just fantastic. She teaches us all the time. I work with this nurse practitioner who's amazing. And I learn so much from them all the time. And it's in a different way. It's I'm very active in the planning for the patient. And I kind of thought, I've been doing this for a while now. I've been a nurse for over 8 years, and I think I'm ready to move on to more of a provider role.
Mm-hmm.
So that's kind of what made me decide.
What do you mean provider role? What?
So nurse practitioner with the ability to write prescriptions and
Okay,
I had no idea that even existed.
Yeah,
Okay,
so
wow.
what are other roles within the nursing field that you
guys.
can...
Yeah.
So nurse
Break it
practitioners, they're great. A nurse practitioner, a lot of people just think it's a nurse. It's a different type of a nurse, but it's a little different because you are yourself a practitioner, but we take on a more holistic approach versus doctors.
Gotcha.
And there's a lot of training that goes into it, but at the end, different states have different rules. But in New York State, you can write prescriptions, you can practice pretty independently. And I believe there's a little bit more autonomy than in a physician assistant program.
Okay.
I don't know a lot about them, but if that's something that somebody is thinking of, that might be something to consider and keep in mind. But being an NP is really more about looking at the patient as a whole and thinking about everything about them holistically. It's not just, here, let me write you a script for this. It's why do you have this issue? And let's look at if we can fix that without giving you a medication first.
So
Interesting.
what, I guess, career doors does this open now when you finally graduate and get this degree?
Yeah.
Do you continue working at a hospital like this and just in a different role, or are you able to branch out into different places?
Yeah, so I can continue. I would love to work at NYU if that position came up, but I can work in a setting that would allow me to see patients similarly to a doctor. Usually it's with a doctor. You would see them and kind of present the case to them and go over it together and make a plan. And sometimes you have a lot of autonomy where you see patients by yourself and they see the doctor maybe once a year and they see you the other times during the year, but you essentially manage the patient. And it can be in all different types of settings. So the program that I'm in now is for family, and it's going to have a special focus with holistic treatments. So that's kind of my goal, is to become boarded in the family, in the primary setting. So actually not working in a hospital. I would be more trying to prevent you from going into the hospital.
Just want to talk about the cost situation just a little bit with this master's program. Is NYU helping with the cost? Or because you work there, you're able to get it for free? Or how does that work?
They do help with the cost.
Nice.
And it ends up being very worth going.
Nice.
Yes.
Okay.
It's a very
Sweet.
good situation. I think it's a little different for everybody, depending on what program you're in. And
Right.
there's a lot of different things, but they're very generous.
Sweet.
So I'm very lucky and very happy with the program.
That I heard that NYU was paying for the tuition for med school, so I was wondering if it was the same thing.
It didn't cross over, but they made a really good point. There are so many more nurses in school than there are medical students.
Doctors,
Yeah. So I think financially it would be hard
Very.
for right now to cover all the nurses. Yeah.
Cool.
Sweet. So then would that be the case, say you're still in the hospital at Newark, I guess, because that's not a university hospital, right?
Right.
Do they have programs or whatever that could help you, that would help with the cost of if you wanted to continue your education officially, I guess?
They definitely do. They'll give you a certain amount of money per semester.
Now, you obviously waited to go back to school. Do some students go right from the bachelor's to the master's and become a nurse practitioner after 8 years? Or
Yeah. Some people go straight through school, right to a nurse practitioner. I don't know if all programs allow you to do that. I think some programs, they want you to have at least a year experience as a nurse first.
That's what I was trying to get at.
Yeah. Honestly, I think that that's the best thing to do, because once you're a nurse practitioner, you're responsible for treating a patient. And if you don't have a lot of background clinical knowledge, it can be challenging. But that doesn't mean that somebody can't go straight through school and be an amazing nurse practitioner.
Sure.
Nice.
But for me personally, I think it helped me because I kind of have an understanding of how things work.
Right. Cool.
So was this in the plans the whole time? Or was this kind of a new
directive?
Yeah.
I think I always thought about it when I was in nursing school. But there's so many different things you can do. You can go back to school and go into education as a nurse. So focus on being a college professor or being an educator in the hospital. So every unit you work on typically has a nurse educator who's there to help you make sure that everybody's staying with the new trends.
Interesting.
Their competencies are up to date. So meaning that every nurse on the unit knows how to give blood the correct way and monitors that throughout the year.
Kind of building on that, a lot of industries have continuing ed requirements. Are there those requirements in nursing?
Yes.
To keep your license?
Yes.
Okay.
Typically, it's, I believe, 30 hours of education every time you need to, like every 2 years. So every time you have
that's about normal. Then
renew your license.
Oh, cool. So what would you have to do?
So we do a lot of education where I work. We have seminars.
NYU, a lot of education, really?
And we go to conferences. So
Cool.
the hours add up quickly.
Yeah,
Nice.
good.
Oh, yeah, I bet.
Yeah.
That wraps up the experience episode in the Nursing MS series with NYU Senior Staff Nurse Jennifer Abate. There's so much that goes into becoming a nurse, let alone actually being a nurse. There was a lot of juicy stuff in that episode and in the Adiddle episode as well. So next, join us in the Discuss episode where we're going to unpack everything that we learned, how you can apply it to your career today, and what advice Jennifer has for you.
Do you need experience? Are you looking for an internship? Well, you can join the team and interview anyone in any industry by becoming an Experience Adiddle student interviewer. Regardless of your major or amount of experience, this is the perfect stepping stone into any internship or career. Apply to the Adiddle Army at experienceadiddle.com/students. That's experienceadiddle.com/students. Thanks for listening. To find the show notes with all relevant links and photos for this series, head over to experienceadiddle.com. That's experienceadiddle.com.
If you learned something in this episode, please take some time to help our mission by leaving a positive rating and review of the show. Each week, we bring you a new interview series with guests from different jobs and industries. In every series, we live a specific day in the life, hour by hour, experience the career journey, and have a discussion about what we learned. So, don't forget to subscribe.